Well, hello. It's a pleasure for me to be here and have this opportunity to speak about something that I love it, and I would like to show you two things, as Raquel said. I came from Spain, and there we have the Semphi group, that is the main Spanish GP federation. It's made up of 17 regional societies, one per each region, and we belong to Madrid, where Semphi is the main group. There we have until 30 working groups in different subjects, and we are not only one more group. We try to connect all the group each other, helping them with activities or research to give more visibility and impact to the message they want to transmit. We try to share the aspects of new technologies and their impact on GP about clinical work, communication, teaching, and research. It's an informative blog, but all opinion and thought are welcome. The most important thing is the participation and dialogue to create and develop new ideas and projects. When I joined the group, they were only two people, Jose and Kini, the two first, and now there are 5 of us, as you see, and we are trying to develop new projects focused on patient and new technologies. No matter where you are, you can teach, you can learn, and you can share information with thousands of people around the world. New technologies offer new possibilities and new tools to make our work easier and dealing with the patient. And we try to present the best of them on our page. We are able to start collaborative works with other health professionals with only one purpose: improve our medical attention. There are different categories into our blog, as you see, and in my opinion, it's necessary to be regular with the posting. You can choose how to do that. You can do daily or weekly, whatever you want, but you need to be regular and always keep a path. We post every day at 5 p.m. and during the weekend at 11 in the morning, one post every day. And when you post any message into the blog, the information is shared automatically on main social media accounts, increasing our message impact. It's important to create a fidelity from followers and get dialogue and collaboration from them. There are many other blogs. There are many other blogs with different topics, or medicine, nursing, physiotherapy. I don't know what you think, but probably in our situation, it would be interesting to share all our ideas and projects about rural medicine in a common space and connect with other doctors and other opinions. And
what do you think about blogging? Are you used to be acting in blogs and comment on blogs and posting? Someone want to give us any kind of feedback?
I don't actually use them, but I do read other people's blogs, and there are a lot of blogs around which are really useful for information sharing in terms of...
I said I don't blog myself, but what I do is read other people's blogs. You'd be surprised the amount of information that is out there and that is available if you're just prepared to surf around and look for it. And some of it is patient forums, because you're not always aware of what patients think about issue X or Y, and you'd be surprised how quick that information can be useful.
It's a good way to share information and keep the people informed about apps, new technologies, or new projects.
This project is amazing because it's a blog made by doctors, and they're speaking about different tools and new technologies, how to use them in a very easy language. And they are really having a great impact in Spain.
I think, we live in an age of information overload. We saw the presentation from Intel this morning downstairs, about the fact that in the last 2 years, 90% of the world's retrievable data has been uploaded in the last 2 years. And time is important. I like to be very selective of what I read or how I use my time about information I give. There's lots of reinvention of the wheel as well, all over the world, everybody doing the same thing. I think unless we take a step back and think about what we're doing carefully, and awareness is really important, we'll all just run like headless chickens and like lemmings over the edge of a cliff of information. So I think it's very good, but where does it inexorably lead to is the question I would ask. You know?
Thank you so much for raising this point. The last word.
I think blogging is an interesting one because I'm a GP in London, and recently the other GPs also, we're having a chat about how do you manage your information, and one of them said, actually I do my own private blog just for myself and I just keep everything there. It's the only way to keep control. And I recently started a project, and among those group of GPs I just shared it with them, and it's really helpful in terms of keeping track. Otherwise there's just so many emails and it's just that, where are you? That's how I use the blogs.
Thank you so much. For sure, there's a lot of information. You can get crazy going through all the information, but you can also get crazy going through all the articles published in the literature, medical literature. So it's a comparison. You can go.
Only a few more words. Only to speak about another way to use Facebook to connect with our patient. I would like to explain quickly our project in my general practice. My health center is called Castroviejo and is situated on the north of Madrid. And we did a health education project in school with children aged 14. We thought that could be a good idea to create a Facebook profile, not a Facebook profile, a Facebook page, it's different, to connect with them, share the information, and keep sending messages about healthcare. Because the young population doesn't come to the office really often, and also they need our education. After our first session with them, we discovered that most of them didn't have a Facebook profile, so it was a pity. We didn't stop, we keep growing up, and we decided to expand to other social media. And after that, at the beginning, it was a bit difficult because people didn't really participate so much, but we decided to keep working and prepare different topics for each month and expand our audience to the rest of the health center population. The participation was increasing day by day, and some discussion was generated. This kind of thing could be really good to connect with the patient and keep them informed about healthy way of life. I'm finishing. Now I would like to know, after the presentation, what you think about this. What can we do with all these tools to improve our practice? And what limitation do you think there are to use them? Thank you so much for your attention. And